Everyone, it's Raj from 3CB. Arsenal and England international goalkeeper Aaron Ramsdale missed the Aston Villa match and now is also out of international duty after suffering what Mikel Arteta called an oblique injury. I originally thought this injury might be to Ramsdale's hip as he landed heavily on it in the tail end of Arsenal's win over Leicester City, but it turns out that it occurred around the 30th minute versus Liverpool, with Mikel again saying that Ramsdale was having some issues over the final 60 or so minutes of that match, and therefore he missed the subsequent match versus Aston Villa. The obliques are a pair of muscles that go from the rib cage down to your hips, and they're heavily involved in rotation and also resisting rotation. There's two different kinds. One's called the internal oblique and the other is the external oblique. Most commonly in footballers, the internal oblique is injured. External oblique injuries are actually very, very rare. Like other muscle strains, these come in 3 grades: mild, moderate, and severe. From everything that I've gathered and from what I've been told, Ramsdale injury is considered grade 1 and mild, which typically takes 1 to 2 weeks to recover from. So he should be good to go when Arsenal return from the break versus Crystal Palace. Of course, we'll have more information during team training in the lead up to that match. The first goal of Physio is decreasing the level of pain and dysfunction, which is why Ramsdale missed that match versus Aston Villa and did not go to international duty. And then it's rebuilding the tolerance of that muscle to those rotational activities. As you can imagine, for a footballer and especially for a goalkeeper, there's going to be a lot of rotation, so you have to rebuild the capacity of those muscles. I'll keep you updated as we learn more.